The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We have our expert, Dr. Luke Johnson, a dermatologist, to teach us all about skincare, healthcare, and how to look and feel our best during pregnancy.
Dr. Luke Johnson is a dermatologist with the University of Utah. In addition to his clinical work, he co-hosts a podcast about dermatology called Dermosphere. Check it out here, and we'll link it in the show notes.
All right. Hi, everybody. Thanks for being here. Thanks for me being here. Thanks to you guys for having me on.
Thanks for coming on the show. We're so excited to talk to you all about the changes that happen to our skin during pregnancy and how we can take some measures to prepare, maybe prevent, maybe repair in some instances. The reason I wanted a dermatologist on the show is because of my own experiences during pregnancy and postpartum. My first son was born in August, and I had really bad melasma. And melasma is a brown pigmentation that shows up. You can kind of see, I even have some still on my upper lip that just won't go away. And I thought to myself, I need to share this information with other people because I had no idea what I was supposed to be doing, how to prevent it, how to look and feel like myself again after this circumstance. And luckily, a dermatologist was able to help prescribe me some cream. I had actually gone in for kind of like a poison ivy rash. And that's when he said, "Do you want to ask me about your face?" And that's when it all happened, and we were able to get my melasma treated. But for all of those women who are experiencing melasma in their pregnancies, we want to give them some knowledge and some resources right from the get-go.
Yeah, well, I love skin, and dermatologists, of course, we love our creams, so no surprise that you went to a dermatologist's office and came out with some cream. There's lots of different things that can happen to the skin during pregnancy. Melasma is fairly common. There was one big study, it was out of India, so potentially not generalizable to everybody out there, that said slightly over half of pregnant women ended up with melasma, which is like a lot of people.
So tell us kind of what is the first step that we need to do to prevent melasma? Is it preventable?
So melasma specifically, and some of these other pigmentary changes, again, quite common. So other pigmentary changes are even more common than melasma, again, according to at least this one study, which is the biggest one that I could find. So nipple hyperpigmentation is actually the most common. Something like 80% of pregnant women get that. And then there's another condition called linea nigra, where pregnant women can get sort of a dark line going down their pregnant bellies. And those are both a little bit more common than melasma. Melasma, I imagine that a lot of your listeners have seen it or know what it is, but you get these tan patches on the face, cheeks, upper lip, and forehead are the most common spots for it. Pregnancy is probably the most common trigger, but it can be caused by other hormonal changes. So, for example, it can be caused by people taking birth control pills. And the best thing to do to help prevent it should surprise nobody that this dermatologist is going to say sun protection. We love sun protection in the world of dermatology, as everyone knows, which of course means sunscreen, but not just sunscreens, big hats, long sleeves, staying in the shade, sun protective clothing, all that stuff. For the face in particular, big broad-brimmed hat can probably help a lot. And then sunscreen on your face every morning, even if you're not planning to go outside, is a great idea. For days that you are going to be going outside a lot, reapplying every 90 minutes to 2 hours is what we recommend. To prevent dark spots, or to help dark spots improve specifically, the best sunscreens have been shown to be those that contain iron oxide. Those are usually tinted sunscreens. So if you find a tinted sunscreen that you like, then that's usually your best plan. Whether or not melasma can truly be prevented, I don't think has been well sorted out in the literature, but I would say sun protection is really where to start, and obviously has plenty of other benefits as well.
And so are those your mineral sunscreens?
Iron oxide is a mineral ingredient, but it can be incorporated into lots of different kinds of sunscreens. So as you suggest, in dermatology, we differentiate usually between two different types of sunscreen, chemical and mineral. The mineral-based sunscreen ingredients, in addition to iron oxide, are titanium and zinc. And then the chemical sunscreens are a bunch of compounds that nobody can pronounce. And we know that the chemical-based sunscreens get absorbed into your blood in small amounts, but detectable amounts. We don't know that they do anything bad when they get absorbed into your blood. But just to be safe for kids and probably for pregnant women, I usually recommend the mineral-based sunscreens. So you'd probably want to look for something with iron oxide and then also zinc or titanium.
Speaking of absorption, I've heard that your skin is the last of your organs to receive nutrients. What would you say to speak to hydration and just really getting the skin healthy?
Limited data with that kind of stuff. Of course, probably staying well hydrated can help out a lot of different things. Whether or not it actually helps out the skin is, like, if drinking water helps the skin, I don't think has been well sorted out in the literature, but can't hurt. Using moisturizers on your skin can, of course, help prevent it from being dry, which is usually just annoying to have dry skin. We live in Utah, which is a super dry spot, but I'm sure there are other people out there who get dry skin even if they're in humid environments. I didn't learn this until I became a dermatologist, but it turns out that moisturizers don't work by adding their own moisture to your skin. They work by preventing your moisture from leaving. So because of that, the thicker and greasier they are, the more effective they are at preventing your own water from evaporating away. So you want to use the thickest, greasiest thing that you don't mind putting on your skin. So I love plain old petroleum jelly. Anything you have to like scoop out of a jar is going to be more effective than something that pumps out of bottles. Shea butter, coconut oil, also good choices, especially if you kind of want to go the natural route. Don't use olive oil. For some reason, that one disrupts your natural oils, but just about any other oil would be fine.
Oh, so fascinating. In some of your research, in some of your clients, why are we seeing such skin changes during pregnancy?
A lot of different reasons. The hormones, of course, change during pregnancy, and we blame those a lot for the hyperpigmentation, the melasma, and so on. The immune system is also shifting in pregnancy, blood flow is going in different directions, and all of this can have an effect on the skin as well as, of course, lots of other organs. By the way, to all the women out there, thank you for perpetuating the species. I know there's a lot that goes on with it.
Yes, so true. What about swelling and things of that nature when we are talking about water and absorption and retaining? Is there anything that a dermatologist recommends with the swelling?
Fortunately, a little less common than I thought. Again, most of the data is based on that one study I mentioned, which is the biggest I could find. It happens in about 25%. I thought it was going to be more like 90%. People get significant swelling. Compression stockings. I don't know if you've had other guests talk about those, but dermatologists love compression stockings. They come in lots of different varieties in terms of the strength of compression they put on your legs. And the metric they use is millimeters of mercury. That's just the way they describe how much pressure, mmHg. You'd probably want to start with 10 to 20. And then you can go up from there if you want something that just swaddles your legs a little bit more and that helps prevent the fluid from pooling in there. And one reason it pools in there is because the legs are far away from the heart, and arteries have muscles that kind of push the blood along, but veins don't. They have valves to prevent the blood from sort of flowing backward, but in certain states, then those valves are not held together like this, but they get stretched out, and so they don't do as good a job at preventing the water from flowing backwards. And so squishing it all back together can really help get the blood back up toward the heart so it can be recirculated. Of course, there's parts of your body besides the legs that can get swelling, and if that happens, then usually I would recommend just talk to your OB-GYN because they might have some special garments, etc. that could help.
I often see a pregnant woman at the end of pregnancy that has kind of like a swollen nose, a little bit more in the face. Is there anything, since we're probably not going to be putting that compression stocking on our face, is there anything we can do there?
Nothing that's a good option. There are people who have medical conditions where they have that, and like there are special masks that exist, but I don't think most people want to walk around with those. I would just make sure you have close follow-up with your OB-GYN again, because every so often significant swelling can suggest that there's some other medical problem that needs to be addressed.
What about varicose veins?
Yeah, for sure, but again, based on that study, very low incidence. About 3% of pregnant women get varicose veins, so that's quite small. And probably the way to help prevent those, if you can, is the same approach to preventing the swelling, because it's the same idea. The veins get full of blood, and if they get full of blood for long enough, then they just kind of stay stretched out. So hard to recommend compression stockings highly enough. I think my wife wore them throughout her pregnancy and is glad she did. You can get cute designs. There's a number of particular product lines out there that, look kind of fun, and once you get used to them, I think they're not particularly uncomfortable and can even feel kind of nice. Your new baby's going to be swaddled, and hopefully your legs will like it too.
Is the recommendation to wear the compression stockings day and night, to only have them on certain hours of the day? What's your recommendation?
It's probably most important to have them on while you're upright, because that's when the blood flows down and pools in the legs. So assuming you're going to be sleeping with your legs elevated, they would not be as important, but they would probably still do some good if you preferred it that way.
Oh, that's so great to know. Towards the end of my pregnancy, with my son born in August, my back was really hurting, so I put on one of those belts, and then my legs were swelling, and so I was wearing compression socks. I felt kind of like a stuffed sausage, and my body felt that too, because all of a sudden I was overheating. I was feeling like I was going to hyperventilate, and I thought, okay, time to release a little bit, maybe just wear them occasionally. But I know the benefits of compression stockings are really good too. So that's why I was curious if we should wear them, just during the day or at night as well.
Yeah, that's my opinion anyway. And if you get some time to relax and can elevate your feet, up on an ottoman or something, then that would be another time to take a break potentially.
I think that it's so important to recognize that all of these changes that are happening in our bodies with pregnancy, most of them are normal, but like you said, some of them are not. And to say, I'm not feeling like myself, I'm not feeling very good right now, and recognizing that if we're feeling ill or feeling sick, then we can't just push that off. We need to kind of seek more help for that.
You're plugged in. There are also some specific skin diseases that can happen in pregnancy that, of course, we as dermatologists learn about. Some of them are fairly common and some of them aren't. But if you get funny rash during pregnancy, then you certainly want to talk to somebody, especially if there's blisters or pus bumps or something like that, or if you're real itchy, because those can be serious.
Can you tell us more about rashes during pregnancy?
Yeah, so of course pregnant women are still human, so they can get just about any other kind of rash that's out there. There are 5 specific rashes that are associated with pregnancy that we learn about in our textbooks. One is called peritic eruption of pregnancy. It happens most commonly during the first pregnancy and shows up as really itchy lines along the belly, but usually not right around the belly button. It's super itchy and annoying, but not dangerous to mother or baby, but still there are things that can be done. Because of the immune shifts that are thought to happen during pregnancy, that can sometimes trigger eczema, especially in people who have had eczema before, but maybe not since childhood. They can get it during pregnancy. Itchy pink rashes, often on the hands, on the neck. It can be anywhere. Those are usually pretty well controllable with some of our medicines. And then the uncommon ones have fancy names like pemphigoid gestationis and pustular psoriasis, and those are the ones with big blisters or pustules, or people who are so itchy they can't sleep, and again, those can suggest that there are other problems and they need to be addressed by a medical professional.
In 2 out of my 3 pregnancies, I found out that I was pregnant because of a rash. The first time, I just had it kind of all over my legs, and then found out a couple days later I was pregnant, and I thought, well, that was weird. I wonder if my body was reacting to something. And then the second time, I was planning to get pregnant and thought, all right, here's that rash showing up again. I must be pregnant.
Interesting. I suspect it was the eczema version. There's confusion regarding the names if you look back through the history, but we call it atopic eruption of pregnancy these days.
And is the best way to combat those rashes through creams?
Well, I'm a dermatologist, so the best way to combat anything is through creams, and also sun protection, of course. To start with, moisturizing the skin, like we mentioned, is really good. Over-the-counter hydrocortisone, totally safe. You can use that. And if it's not doing the trick, then your friendly neighborhood dermatologist can probably prescribe you yet more creams that could probably work better.
Are there a lot of creams that are unsafe to use during pregnancy?
Not a lot, but some. And some of them are available over the counter, or they're available over the counter in other countries and they can be brought here. So you just want to make sure you check a reliable resource if you're going to use something. The moisturizers and stuff, those are pretty safe, but creams that are intended to treat some problem, like the anti-wrinkle stuff or the anti-pigmentation stuff, sometimes those are not considered safe in pregnancy. Though really there hasn't been research on pregnant women that's shown that they're unsafe in pregnancy. Most people wouldn't want to do those studies, or they might even be unethical to perform. But still, they're known to either be absorbed into the blood, or if you take a similar medicine by mouth, they're known to cause problems, so it's safest to just avoid them if you can. Though if you accidentally use them, I think the odds of them becoming a problem are really, really low.
Do you recommend collagen for the skin during pregnancy?
I don't really recommend them for anybody ever. Most doctors think it doesn't make a lot of sense that if you take collagen by mouth and it goes into your stomach and gets broken up into little amino acids, that somehow it turns back into collagen and gets to the skin. It just doesn't make a whole lot of physiologic sense that something like that could happen. I don't think they're like dangerous to take. It just they seem like they might not be worth it. And then if you rub something like that onto the skin, again, like how is it getting incorporated underneath the top layer of the skin into the collagen that's already there? I think there's better ways to focus your energy.
Speaking of focused energy, do you have certain tips and tricks that you give to women who are pregnant to keep their skin radiant? I know we kind of have that glow anyway, but do you have any recommendations to keep our skin healthy during pregnancy?
We've already talked about most of them. Sunscreen and sun protection, moisturizers, compression stockings, and then make sure you're not using creams that are not considered safe in pregnancy. And then other than that, if things happen during pregnancy that bother you, acne for example, super common in pregnancy, there are some options. But we usually have many more options to treat these things after the baby is delivered. So don't hesitate to reach out if there's something going on in your skin that you don't like or that's symptomatic, so that we can help.
I know this is a little adjacent to dermatology. My friend gives facials and she talks a lot about the lymphatic system and flushing things out. Could you speak to the lymphatic system for a moment?
There probably are some things. There are facials and chemical peels and stuff that probably would be considered safe in pregnancy. I don't know that I usually think they're worth it, even when people who aren't pregnant. So I think that the things we've already mentioned give you your biggest bang for your buck and for the time and other resources that are involved in it. That's probably where I'd focus for most pregnant women, especially because you probably got a lot of other stuff going on in your life.
You spoke a little bit about chemical peels. What is the negative effect of a chemical peel if you're trying to fight melasma?
It depends on the peel. So there are different kinds, and they are irritating to the skin kind of by definition, and especially in darker skinned patients that can cause worse pigmentary changes. For lighter skinned patients, there are probably some that would not be crazy to use during pregnancy, but there are some, especially salicylic acid, that are not considered a safe thing to put on the skin during pregnancy.
So if you're using a heat treatment, is that actually going to make your melasma worse?
Again, it depends mostly on the underlying skin type. So if you're a Caucasian person, then probably it would be helpful. If you're a darker skinned person, then there's a risk there. So you want to make sure you're going to somebody who is familiar with those risks and is able to pick the proper laser with the proper settings for your skin type.
Moving on from mom a little bit and towards baby, do you work with infants at all, or how does infant skin relate to adult skin?
Oh yes, I love babies. I'm a pediatric dermatologist by training, though I see both kids and adults in my practice, so I see a lot of babies, and they're adorable.
Yeah, I remember the first thing with my oldest was the baby acne. He did have a few spots. My other two didn't, but what is the cause of that?
Again, it depends. So there are different medical terms for what most people refer to as baby acne. The stuff that shows up in the first 4 weeks of life, the medical term is neonatal cephalic pustulosis, which is just a fancy way of saying pus bumps that newborn babies have on their faces and heads. And that's thought to be caused by a yeast, which just normally lives on the skin, but in newborn babies it can cause this sort of acne-looking stuff. It's not a dangerous thing. It goes away on its own if you feel really motivated. Sometimes we treat it with like anti-yeast treatments. And then usually later in infancy, there is something actually called infantile acne, which is quite rare. I've only seen it 2 or 3 times, and I've been practicing for about 5 years probably. But it's thought to be due to hormonal shifts. I guess in babies, just like in teenagers, they've got a lot of hormones going on, including testosterone, both male and female babies, and that can cause acne like it causes in teenagers. Usually it's pretty mild, but there are treatments if it's not. And then there are various other bumps that babies can get on their face that some people refer to as infantile acne or baby acne, when it's actually, we call it something else like milia or miliaria. And again, a lot of these things are within the realm of normal, I would say, and kind of go away on their own. If you've got any concerns, though, of course, we're here for you.
The cradle cap is something that also is like really prevalent when your baby's a few weeks old. They'll kind of start looking really scaly, almost like that lizard skin. Do you recommend more gentle treatment at the beginning? Do you recommend just kind of attacking it straight on with those hydrocortisones?
That's again caused by a yeast, and as you suggest, babies will outgrow it, though it can take a surprisingly long time sometimes. It's not dangerous, and it often doesn't bother the baby. It kind of bothers the parents more than the baby usually, and so we tend to be fairly hands-off. Gentle shampoo, gentle brush to kind of gently dislodge those scales. Adults can get the same thing, which causes a lot of dandruff. The medical term is seborrheic dermatitis, and the over-the-counter anti-dandruff shampoos, like your Head & Shoulders and Selsun Blues of the world, they work because they have anti-yeast medicine in them. So the next step beyond just sort of gentle shampooing and brushing is to potentially use one of these over-the-counter anti-dandruff shampoos, kind of rub it into the baby's head, let it sit for about 5 minutes, and then rinse it out, but be careful it doesn't get into their eyes, of course, because it's not formulated like a baby shampoo and could sting.
Is that something that can be used multiple times a week? Should it just be used sparingly?
Yeah, 2 to 3 times a week is usually fine if you need to.
And then babies, their skin is more prone to drying out and things because they've spent so much time in water? Or is that just kind of case by case?
No, usually that's not an issue unless they're a premature child, like in the NICU. In that case, we do see that skin barrier issue. But most full-term babies, that's not a problem. However, eczema, the medical term is atopic dermatitis, is quite common in babies. We think about 1 in 5 babies gets this. And so if you notice sort of dry, pink, potentially itchy rash, especially like on the cheeks, then that could be what you have noticed if you've noticed some dry babies in your time.
Is there any recommendation for babies to be out in the sun ever?
Party line is they should just avoid the sun until 6 months of age because we don't have data that says that sunscreens are safe before that time, and so we say just keep them out, have them wear like a cute little bonnet and stay in the shade if they're going to be outside for some reason. That said, especially the mineral-based sunscreens like we discussed before, it's hard to imagine those are some kind of problem in an infant, especially because similar ingredients, the zinc oxide in particular, are used as diaper pastes very commonly, including in like premature newborn babies, and they don't have a problem. So that's the party line. Mineral-based sunscreens, cute hats.
I remember talking to a new mom who said, like I was told to have my baby like soak up some rays for the vitamin D. You still would then need some skin protection because that little skin is going to burn, and we want to avoid any sort of sun damage or a sunburn, especially when their skin is just new and fresh and soft and delicious.
Well, I'm with you, though recently I've heard a number of people say, like, isn't some sun exposure good for you? And it's difficult for me to say unequivocally yes, but I think it's good for human beings to get outside and have sunlight shine on our eyeballs and enjoy the world. Whether or not it's good to have sun shining on your skin, I'm not so convinced of. There has been studies that show that sunscreen, for example, does not inhibit vitamin D absorption or creation in your skin, so I don't buy that argument, for example. But, we could certainly go overboard. Mark Twain says everything in moderation, including moderation. So if you're going to be outside for 10 to 15 minutes, then I don't think sun protection is all that important, because the odds of anything significant happening in that time frame are extremely low, unless you're a super pale redhead or you have a genetic disease. Otherwise, if you're going to be out for more than 10 or 15 minutes, then we recommend the sunscreen and the hats and all that jazz.
I've recently found a UV index and it has changed my life because there's times when I think, oh, like everybody needs to get their sunscreen on. It's a terrible day. And I look down and I'm like, oh, we're at a 2 right now. This also applies for later in the evening. Like if you're going swimming and it's 6 or 7 p.m., you can look at your UV index and all of a sudden you realize we actually probably don't need sunscreen because we're still, like at a 2 or a 3 in that level.
Not sure I can 100% endorse the we don't need sunscreen after all approach to life. I think it's useful to check the index occasionally. My default would still be to put it on, because better safe than sorry.
They can always tell that I have glasses because I'll get a facial and they'll say, "Oh yeah, you have that protection." And I've made a goal to wear sunscreen more often. But yeah, that is a good reminder to just default to sunscreen.
Yeah,
And
wearing that
remember,
sun.
it's not just sunscreen, it's sun protection. We love hats. There's the clothes that say UPF, sun protective clothing. You can buy them online. They're not very expensive. I think I bought a 3-pack of shirts for $35 recently. You can wear those. I think they're more comfortable than like a normal cotton t-shirt when it's really hot outside too.
And wearing sunscreen every day, even if it's just a little bit in your moisturizer, can then also help to prevent premature aging and those sunspots and age spots. And you want to always keep that skin radiant and glowing.
Yes, not just premature aging, but like normal aging. People who put sunscreen on every day look younger than their actual age. I put it on every day, regardless of what I'm going to be outside or not, and I'm 85 years old. Look at me.
I want to talk a little bit about the nails and the hair. You probably don't see a lot of patients or clients coming in for hair loss with pregnancy.
The type of hair loss you're referring to is probably what's called telogen effluvium. It's the second most common cause of hair loss in adults, besides just like male and female pattern hair loss. It's thought to be caused when the body feels that it's under stress. And so a physiologic state like pregnancy or having given birth to a baby, the body feels that there's a lot going on out there and it needs to conserve its resources. So it diverts those resources away from the hair. The hair doesn't fall out right away because it's still stuck to the scalp. So it usually starts shedding 6 weeks to 3 months after whatever this event was. So this is one reason why new moms often will lose a bunch of hair, and they have a 3-month-old baby that they bring to our offices with them. The good news is that once the body is not under stress anymore and feels the coast is clear, it returns those resources to the hair and the hair completely recovers. So the best thing you can do about this type of hair loss is not worry about it. Because stress, of course, makes it worse. So just know that it will get better.
So the expensive shampoos, all of those things aren't just the cure?
I'm afraid not. A lot of those products out there that are marketed for hair or for skin and are expensive are really suspicious. I think they have fine ingredients for the most part. They're just not really worth it.
Do you have any favorite shampoo brands?
Nope.
That's so good to know because a lot of times we spend a lot of our energy and our focus on the marketing of a product or the viability of a product, and to know that, it might not make that much of a difference. Find something that works for you.
I would just find something that's not too expensive that you like and try to avoid anything that's pushed on social media. That's kind of a red flag.
Anything to speak to nails? I know with prenatal vitamins that just really enhances the vitamins, makes my nails grow faster. But
Nails, I haven't had a lot of pregnant women complain about nail issues because pregnant women are usually young and healthy women, and young healthy women and men and other genders usually have pretty healthy looking nails. It's when we start to accumulate wisdom in our lives that we just naturally have less moisture in many parts of our body, including the nails, and the nails can get kind of brittle in those cases. They can get kind of these white lines and so on that people don't like. And so there are products out there that aim to return moisture to the nails. There are vitamins that are marketed as being good for the nails. Biotin is kind of the big one. The recent research suggests that biotin is not helpful for your hair. So if anyone out there is taking biotin supplements for their hair, I don't advise it. It probably does do something for the nails. Whether or not it's enough to notice, I think, is sort of questionable and probably varies person by person. If you're going to take supplements like this, just don't take more that's listed on the bottle, because sometimes they can cause some kind of toxicity or they can interfere with medical tests. That's something that's been shown with biotin recently. Otherwise, your nails probably look good. Enjoy them.
We always think about pregnancy being a time where our baby is taking so much from us. They're taking my hair, they're taking the strength of my nails, and just recognizing that we don't have to worry about any of those problems.
Well, yeah, I don't think so. There's probably other places to put your worry energy if you must worry about something. If your nails are giving you trouble, sometimes just clear nail polish can help strengthen them and make them look a little better.
Well, on our podcast, we love to share resources. Do you have any resources for our listeners today?
Your friendly neighborhood dermatologist is a pretty good one, especially if you're worried about anything in particular showing up. I don't have any resources that I think I would recommend about pregnancy skin stuff, but about dermatology stuff, there are a couple websites out there that are a little bit more reliable than the general interwebs. There's one out of New Zealand called dermnet.nz, which has pretty good information and is sort of intended for both patients and medical professionals, so usually the language is understandable even if the words are a little bit confusing.
That's great. Thank you. We will put that in the show notes. Every week we share a Mom Squad secret from someone in our community. This week it's from Carly, and she says, labor is 80% mental and 20% physical. Mental preparation is important. You can read positive birth stories and get encouragement from your friends. And I love that. Just as we've talked about worry here and there, our mind has so much to do with our power, and just keeping that in check and preparing mentally can go a long way.
I have never given birth, but my wife has, and parenting is hard. There's a lot of things in life we do that's hard, but then sometimes I think, well, look at all these other people who have successfully done this, and I feel like I'm at least as capable as they are, so even though it's tricky, we got this. So, you guys got this.
Let's all take the advice of Dr. Luke Johnson. We've got this. Thank you so much for being on the podcast today.
Thank you so much for having me. Good luck out there, listeners.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.